My name is Hannah Owens, and I'll be doing my persuasion speech on why we should vaccinate our animals. So, one, a lot of people consider their pets as children. When we have children, during the growth and development process, we vaccinate our kids. Why not vaccinate your pets? What are the risks of not vaccinating your pets, and am I capable of contracting those same diseases? Well, the first proposition would be that vaccines protect not only your pet, but you as well. Common diseases that we share with our animals is leptospirosis. Leptospirosis is a bacterial virus that lives in water and warm soil. These leptospires are contracted through contaminated urine and water. These can be transmitted through your eyes, nose, mouth, or broken skin, which means cuts or scratches or any open wounds that you have. These bacteria attacks the kidneys, liver, brains, lung, and heart. You're at risk in all areas. That includes rural, suburban, or city areas. Some of these symptoms include jaundice, fever, depression, lethargy, muscle weakness, tremors, respiratory issues and distress, and increased thirst. Vaccine reactions have been proven rare. I know most people will ask, well, what are the risks of vaccinating my dog for lepto, and are vaccines reactions possible? They are possible, but rare. At most, we might have a lump that will go down within weeks, or some swelling, which we also recommend to just put ice packs in the area. Other diseases that commonly affect us is Lyme disease. Now, although we don't get Lyme disease directly from our dogs, if our dog is not on flea and tick preventatives or not vaccinated, they are very well capable of bringing deer ticks, which transmit Lyme disease, into our home around children, friends, and family. These symptoms of Lyme disease include lameness, painful joints, lethargy, arthritis, or lack of energy. These symptoms are very well seen through younger dogs. With older dogs, it may be a little bit difficult due to old age. But in younger dogs, no dog should be limping or acting as if it has trouble getting up or going down the stairs. Lyme disease can lead to heart disease, central nervous system disorders, or fatal kidney disease. Flea and tick preventatives and yearly vaccines prevent Lyme. So those are preventatives that we would also always recommend year-round to do. Another disease that is very well common between animals and humans and livestock alike is rabies. Rabies is fatal. It's a fatal virus that attacks the neurological component of our body with irreversible damage. This can be contracted through saliva, usually through a bite wound. We can also contract this from a rabid animal through our eyes, nose, mouth, or open wound. Symptoms or signs of rabies include fearfulness, drooling, staggering, aggression, difficulty swallowing, paralysis, seizures, or most uncommon is seeming unnoticed, uncommonly affectionate for some animals. Not all animals completely show aggression. In underdeveloped countries, rabies kills over 59,000 people with underdeveloped vaccine programs. These stray dogs in streets continuously put the people in those countries at risk of contracting rabies. So what we have done is created a vaccine for dogs, cats, rabbits, ferrets, select horses, and livestock. There is no excuse not to get vaccinated for rabies, besides the fact that most states have made it a law to get your pets and animals vaccinated for rabies. My second proposition would be vaccines ultimately keep your pet healthy, and treatments can run up to $1,000 at a time for treating for really bad diseases such as immunodepressant diseases. In cats, we have feline immunodeficiency virus, which is FIV. This disease in particular don't always show symptoms until years later after infection has taken place. This virus can remain undetected while weakening the immune system this entire time. So these symptoms include enlarged lymph nodes, weight loss, diarrhea, fever, anemia, dental disease, and wounds that seem to to not heal at all or continuously reopening. This can be transmitted through bite wounds, typically with other cats and stray cats, or if you have an indoor-outdoor cat, they are at risk of being bitten by another cat. Uncommonly so, we also realize that this can be transmitted from mother to offspring through the milk itself. Another immunodeficient disease is feline leukemia virus, which is a transmittable RNA retrovirus that severely inhibits the cat's immune system. This is most commonly diagnosed as the cause of disease and death in most domesticated cats. This does not also, similar to FIV, does not always show symptoms, and we recommend if you adopt a new cat to get it tested immediately. If you pick up a stray, to get it tested immediately. If you have a sick cat, get it tested immediately. These things can always change. Symptoms include enlarged lymph nodes, fever, lethargy, abscesses, jaundice, chronic skin disease, and more. With feline leukemia, cats can also develop lymphoma, leukemia, and other tumors alike. Unfortunately for cats, there is no cure for FELV, which is feline leukemia virus, and cats can die within 3 to 4 years after infection. Preventatives include keeping your cat indoors, deworming constantly or yearly, especially when they're young, flea and tick treatment, yearly vaccines, and visiting your vet at least twice a year. While we're visiting your vet, speaking of the blood test that we use is ELISA, which detects the antigens and the feline leukemia virus. And FIA and PCR blood testing just confirms the positive ELISA test results. The reason why we usually recommend to do the testing prior to vaccines is because sometimes blood tests cannot differentiate whether we have a positive vaccine or a positive illness. My third proposition would be scientists have all agreed that vaccines have prevented the death and disease in millions of animals a year. One highly contagious disease includes the parvovirus, which is a highly contagious and debilitating virus contracted through infected fecal matter. You can use your imaginations for how they contracted it. This virus can survive on clothes, carpet, floors, shoes, anything. And so usually when our dogs or sometimes kittens contract these things, we have to clean everything with bleach and bleach only seems to work. These symptoms include severe depression, high fever, profuse diarrhea and vomiting, sometimes blood and stool, lack of appetite, and can lead to shock and death. This disease is also another disease where it will run you thousands just to treat. IV fluids and hospitalization is recommended in isolation to prevent further spread of the disease. If we do not treat this disease, the percentages of survival is 10% and 90% likelihood of death. Canine distemper is also a very highly contagious virus that attacks the lymph nodes, but then the respiratory, urinary, digestive, and neural systems. Vaccines are important since all dogs and once in their lifetime encounter distemper. And once contracted with distemper, death can be immediate within 1 to 3 weeks. This can be transmitted through fresh urine, blood, and saliva, and can also be in contact with sneezing, coughing, and sharing food and water bowls with 2 different dogs. Early signs include thick and yellow discharge of the eyes and nose, fever, dry cough, diarrhea, loss of appetite. Late clinical signs include confusion, head shaking, brain involvement, seizures, and chewing motions. Another disease that is a highly contagious respiratory disease is canine influenza H3N8 and H3N2, which has been found and spread throughout 30 to 41 states. These symptoms include coughing, retching, sneezing, nasal discharge, and lethargy. 20% can have moderate to severe illness and often lead to pneumonia, which lasts for several weeks. So, with that being said, vaccines are essential to our lives. Annual exams will ensure that your pet is healthy and that you stay healthy. Vaccines also help protect our environment and communities and our livestock. And that's my argument for today. Please vaccinate your pets.